So today we're going to talk about the SI joint and how to correct any SI joint dysfunction at home. So the SI joint is back here. You have three pieces of the pelvis. We have one ilium, one half of the pelvis, another ilium, the other half of the pelvis, and the sacrum, which is this triangular shaped bone in the back. So basically the SI joint is where the ilium and the sacrum come together. There can be a shift here and that can cause some pain. So what we're going to do is give you some techniques on how to correct that. And a tricky part with that is knowing which side needs to be corrected. So generally you are correcting the painful side, especially if you've been to a chiropractor or a physical therapist before and they've told you which side to correct, then you can correct that side. So another way you can know if you need to correct the SI joint are some different mechanisms of injury. If you've stepped off of a curb, if you have one leg that is longer than the other, if you are pregnant, or if you have a history of SI joint dysfunction as diagnosed by a medical provider, then these things might be something you would like to consider. Okay, so right now we're going to do a technique to reset the SI joint. This is something you can do at home, but basically it's going to rotate one of the innominate bones backwards. So the innominate bone is your hip bone. Basically the pelvis is made up of two hip bones and the triangle-shaped sacrum in the back. We're rotating one so that all of that can be in alignment, because sometimes one side is rotated the wrong way. So what we're going to do to change that is a little muscle energy technique. So Mary here is going to help us demonstrate. She's going to straighten this leg. So this would be for a left-sided SI joint dysfunction. We're going to bring her leg up here, and she's just going to push down against this hand while this hand is resisting this leg coming up. So she's pulling up with this leg and pushing down with this leg. And she's going to hold that for 5, 4, 3, 2, 1, and relax. And then she would just do that 5 times in order to rotate that ilium. So if you need to correct the right side of the SI joint, we just do the opposite. So you would just lay down, and we're going to pull up with the left and push down with the right. If you don't feel enough pressure with that technique, what you can do is wrap both hands around the knee and just push down on the right. Again, hold for 5 seconds and repeat that 5 times. Okay, so today we're going to do a technique to reset the pubic symphysis. If your pelvis is out of alignment for whatever reason, this is an easy technique you can use at home. So we're going to have Mary demonstrate for us today. All you need is a pillow at home. You just fold it in half, and we're going to put it between Mary's knees. And we're just using the adductor muscles right here to contract and cause that reset in the pelvis. So just squeeze in with about 50% pressure, and we hold for 5, 4, 3, 2, 1, and relax. If you feel a little pop, that's perfectly normal. We're just resetting by a couple millimeters at that pubic symphysis, and we would have her repeat this 5 times.